East Belfast is great. It is quite a small geographical area. There are 20 GP practices in quite a small area, so that represents about 115,000 patients in generally quite deprived, lower income area. We've got 20 pharmacists working across our federation.
My role was to lead the project to try to deliver enhanced, improved care for our type 2 diabetics. Part of that was creating and running clinics across those GP practices, and also by supporting and upskilling other healthcare professionals such as other practice pharmacists, nurses, GPs, to help them deliver better care for their patients within their practices.
So I think within the area, some of the patients, it's a more socially deprived area and they don't necessarily reach out for the help as soon as they should do. So it's identifying those patients and what the risk groups are and picking them up and calling them in and reviewing them on a regular basis and making sure that they're aware that you're there as their point of contact and not to be afraid to come in and speak to you.
What has been novel about the approach that we've taken with Stephen is having a pharmacist who has a special interest and a great deal of knowledge and passion in diabetes, and letting him loose using technology to identify the people who most needed his support.
General practice is just becoming increasingly busy as time passes. Stephen would obviously free up time that we have to manage other patients. Quite a few benefits to our patients that are being treated by Stephen. You know, they can be treated in the community. We can often have issues resolved more quickly. It's more difficult if we're referring people to secondary care or trying to get a diabetic nurse specialist for their opinion. You know, it's much easier when we have somebody in-house to contact for support. The patients enjoy being treated locally.
The whole process has been absolutely wonderful here with the pharmacist as well. They've been superb and literally explaining every single thing that I need to know about diabetes in great detail and been super helpful.
By having one lead diabetic healthcare professional working across so many practices, we've been able to standardise care and share best practice.
So I think everybody knows that access to GP services is really difficult and becoming more pressured. Utilisation of general practice pharmacists has created another pathway for patients to be able to access healthcare and advanced specialist healthcare. So this project's been really useful. Stephen's been able to identify patients and actually see them face to face, which has decreased the chronic disease burden within the practice on me reviewing patients. He's been able to see some patients face to face. He's been able to do phone call reviews with patients, initiate new treatments, and then book them in for a review with me, say 3 months down the line.
The benefits of the joint working partnership and collaborating with Boehringer has allowed me to focus more on patient care.
Boehringer have brought to the table many skills that we didn't even know we needed. We've had input from people who are really good at statistical analysis, data collection, even just presenting the data in a way that we wouldn't have known, and that's been really important for us.
We've had so much interest from other GP federations who want to copy this model of care because they've really started to see the value that the pharmacist can play in GP practice.
We are no longer just people who dispense. We can take full clinical responsibility for our patients.
There hasn't been a lot of progression for pharmacists to become advanced and to become specialists. So this project has been a real trailblaze and a real kind of proof of concept for us.
It is a hugely effective way to get optimal care to patients. It's working at a very cost-effective manner. However, we are also going to have a legacy effect over the next years and decades where those patients have much better control of their diabetes, they will have fewer complications and therefore fewer hospital admissions and a great deal less suffering and traumatic events. Therefore, the benefit is outstanding and can't be commended highly enough.